Hi, my name is Ben Kahn, and I'm a researcher at the University of North Carolina at Chapel Hill. A growing body of evidence supports beginning HPV vaccination at age 9 instead of waiting until ages 11 or 12, which we call proactive vaccination. Proactive vaccination may lead to more timely completion of the HPV vaccine series and can better protect children from HPV cancers. National organizations increasingly recommend starting HPV vaccination at age 9, but use different framing to do so. For example, some organizations, like the National HPV Vaccination Roundtable, clearly call out age 9 as the starting age, while others, such as the CDC, include it as an option. To understand the impact of this inconsistent recommendation framing, we conducted a communication experiment with US healthcare providers and other clinical staff, including physicians, nurses, and medical assistants. In our experiment, using a national sample of more than 2,500 clinical staff, participants were assigned to one of 4 recommendation frames. One stated that HPV vaccination begins at ages 11 to 12, another stated that it begins between ages 9 and 12, and a third stated that HPV vaccination begins at age 9. A fourth condition was a no-message control. Then, we assessed participants' willingness to recommend HPV vaccine to patients ages 9 and 10. What we found was that compared to the control condition, the recommendation frame stating that HPV vaccination begins at ages 11 to 12 was the least effective. In contrast, the recommendation frame that said HPV vaccination should begin at age 9 was the most effective, and it performed the best across all subgroups in the study sample. In the same study, we also asked participants about the perceived benefits of beginning the HPV vaccine series at different ages. We found that avoiding conversations with parents about sex and children completing the vaccine series before age 13 were both identified as perceived benefits of starting the HPV vaccine series younger at age 9. Saying that HPV vaccination starts at age 9 in national recommendations is an effective way to encourage all clinical staff to recommend the vaccine at a younger age. National organizations, including the CDC, should align their HPV vaccine recommendations to clearly state that HPV vaccination begins at age 9. Promoting proactive HPV vaccination at this younger age can increase the timely uptake of the vaccine and will also protect children from future HPV cancers. If you're interested in learning more about our work on this topic, be sure to read our full article in Human Vaccines and Immunotherapeutics. Thanks.